Good afternoon, good morning, good evening, depending on where you're joining us from. My name is Michelle Malunga, and I'm your host this afternoon. You're tuned into the 6th episode of the Scale Up PrEP Access Campaign live show, which is brought to you with the compliments of the Zambian Youth Platform with support from PEPFAR and Chaz. Today, I am joined by two amazing gentlemen. Our first guest is Dr. Mando Piri, who is the Provincial Pediatric ART Coordinator. Doc, good afternoon and welcome to the show. And our second guest is Mr. Kennedy Tembo, who is the Technical Officer at USAID ECAP 2. Good afternoon, Mr. Tembo.
Good afternoon, Michelo. Good afternoon, everyone.
All right, thank you. So today's topic is understanding HIV index testing. We'll start off with a question for Mr. Tembo. What is index testing?
Thank you so very much for the question. To start with, I'll start by defining what index is. In a nutshell, index means a pointer. So in the HIV context, when you say index testing, we are simply taking it socially after identifying someone HIV positive. As you are aware that HIV is acquired from someone who has. So there is no one who can infect himself or herself. So we need to find out where the infection is coming from or where the infection might be going. So in that case, we are going to use the person identified first to be positive as an index person to help us to point to a person who could be positive as a result of the sexual network.
Okay, thank you so much for that response, Mr. Tembo. Doc, just to add on to what Mr. Tembo said, why should someone who tests positive be indexed?
Okay, thank you very much. So I think someone that has to be indexed obviously has been in contact with someone that is HIV positive. So one critical thing that you want to identify is that have they been infected, and if they have been infected, can you provide some help that they need, either treatment or any other form? Even for those that are actually testing HIV negative, what is help that can be provided, and that's what we want to get to for that particular person that is indexed. Thanks.
All right, thank you. Mr. Tembo, coming back to you, could you kindly run us through what PNS is and why this is important in HIV prevention?
Yeah, so if we are to draw it back from the definition of index testing, when someone has been tested positive, we want to find out, like what the doctor was saying, we want to find out who are the sexual partners. So in this case, we are going to offer a service that is called PNS, that is Partner Notification Services. So this is done during pre-test counseling in the comfort zone of the client, so that the client is aware on the benefit and the importance of also testing the sexual partners. So that if they are negative, we protect them, they remain negative. If they are positive, they are also put on treatment. Because this is a clinical strategy to ensure that all the sexual partners are put on treatment, those that are positive, so that they are virally suppressed and we break the chain of infection. As you know, that this whole concept came as a full package where we want to achieve U is equal to U. So how PNS is done, during pre-test counseling, a client, like I mentioned, a client is given an opportunity to disclose the sexual partners that have been in contact with in the past 12 months. So the counselor assists, or the healthcare provider professionally assists the client through specialized counseling or discussion, where a client is given an opportunity to reflect, to think through all the usual sexual partners, one-off sexual partners, so that they come, so that he or she comes up with a list, which you call illustration, and they agree on a method on how they can be followed, so that they are given a service or they are given an opportunity to be tested.
All right, thank you so much for that, Mr. Tembo. For those of you that are watching us on Facebook, we're live, as well as Instagram and Twitter, and you can also visit our website, www.zyplatform.org. Now, Dr. Piri, what help can be provided for someone that is indexed and tests HIV negative?
Okay, so one critical thing, as already talked about, it's the whole purpose of index testing is to find whether you have been exposed or not. We already know that you've been exposed or not. So someone that tests HIV negative, there's help that can be there, and one of the issues that we can provide, or one of the methods that we can provide, is PrEP, which is prevent post-exposure or pre-exposure prophylaxis if it's in a relationship that is ongoing, and you still deem yourself to be at risk of contracting HIV. So there's some medicine that we can provide that will help you not getting HIV. For those that have been recently exposed, and we find that you are HIV negative, there's actually a PrEP that can be provided, and that is within 72 hours from the last, if it was maybe an exposure with someone. Okay, so the main issue is to prevent HIV from you contracting HIV. I've talked about PrEP. There's also condoms that can be provided to that particular individual. We can also provide counseling on abstinence if they still want to continue to abstain, or it can also actually be other preventive methods like male circumcision. Thanks.
All right, thank you so much for that, Doc. Coming back to you, Mr. Tembo, could you elaborate further on what social network testing is?
Thank you so very much. So when we talk about social network testing, we simply means it's not very different from index testing. This is a situation where, especially among young people, like adolescents who are having sex with older men. In the olden days, we used to say sugar daddies. Now we call them blessers. So you find that at an institution, say at a university, there's a group of these young ladies that are into that kind of behavior or situation. So when we test one positive, we recruit that person, that young lady, to help us identify young ladies with similar characteristics or who have similar behavior, and recruit. So she's recruited to as a recruiter who is going to go out there and encourage others to go for HIV testing. And then when we test, again, index testing continues so that we reach out also to their sugar daddies.
All right, thank you so much for that, Mr. Tembo. Which brings me to my next question. How easy is it for someone to actually disclose who their sexual partners are?
It is easy, and at the same time, it's not easy. It's easy when the provider, or rather the counselor, understand what he or she is doing, because it takes a lot to help someone understand. As you may be aware, HIV is not painful like other infections like STIs, like chancroid. So because if one has an STI like chancroid, the motivation is the pain to rush to the doctor to get treatment. But HIV won't give you any pain. So the motivation comes from the person providing the counseling. So as counselors or as healthcare providers, we need to make sure that a client understands why he or she needs to be tested for HIV, the importance of treatment, and also what happens when someone is infected, what happens in the body when they are not on treatment, what will happen when they drop out of treatment, what will happen. So after doing that, you win a client, then the client makes what we call informed decision. So when the client is aware of the environment, the client is aware of the biological makeup of his body and also in relation to HIV, that will motivate the client, even in the absence of the healthcare provider or the counselor, to go on and to give the provider more esteem or more morale to go out and also encourage the partner also to get tested, and also encourage the friends or the peers to get tested and to remain on treatment. So it is difficult because of the cost involved. Like I gave an example, here is a young lady who is depending on this blesser or sugar daddy, who doesn't know the HIV status of the young lady, and the young lady could be positive. So if the young lady discloses, the sugar daddy may back off, and there's a cost there because of the sugar that the girl is receiving from this old man. The sugar may go. So that is where it is difficult. Even in we've seen situation even in marriage. A husband tests positive but can't disclose to the wife for fear of maybe IPV or maybe losing the relationship. Also, all sorts of mistrust. So that's how difficult it is. But the onus is on the counselor and the provider, and us that give information, how much information we are giving in, and also the quality of counseling that we are providing will make it easy. We've done it in Zambia. We're at a point where we are getting a few people positive, except that for adolescents where we have more new positives. But in terms of the adult population and these other population, I think we are doing fine because we've enhanced our counseling skills. We have enhanced our skills in terms of providing the service, and we are providing services at the right time.
All right, thank you so much for that, Mr. Tembo. I think I did actually see a question from Enoch, which was talking about KYC. So Enoch says, why is Know Your Child status, KYC, only targeting women and not men in index testing? Doc, would you like to take that one?
Sure, thanks. So thank you very much for that question. So basically, it comes from the science behind HIV transmission, and one of the ways that HIV transmission HIV can be transmitted is apart from the sexual route, there's also from a mother to the child. So the mother and the child somewhat are linked, and the mother is an index case in this context. So if you find that a mother is HIV positive, then there are higher chances that the child might also be infected. So that's why you follow and test the child. Now, if it was the man, there isn't any link per se between the child and the father in terms of HIV transmission, unless the mother was infected by the father, then the mother is again the index case and not the father or the male partner. Yeah, so I think that's the basic science behind it.
Can I add on
All
to
right,
that?
thank you so much. Yes, please go ahead, Mr. Tembo.
Socially, uh, uh, I mean, biologically, fathers are disconnected from us fathers are disconnected from our children. Biologically, our children are more connected to their mothers. That's why we are just social fathers. The best person who knows the real father of the child is the mother. So in the context like what doctor was explaining, in the context of contact, fathers have no contact with their children. But at ECAP 2, we have situations where, because we are implementing the OVC program, which is HIV related. So we have enrolled children on our program who are HIV positive, and they don't have their mothers. They are under the caregiver. The caregivers are the fathers. So in that context, in index testing, the father comes in because the mother is not there. So we want to find out if the biological mother is deceased, then the child becomes an index who is going to read us to the father as a contact. So that's where men comes in. And also, men come in, also we want to encourage men to support their women to avoid IPV, because if we test a child positive, then we go to the mother, is also positive, the man has to come in through the mother, through the wife has to come in. And also the men have to be sensitized, have to understand the biological connection, and also how it's going to benefit them if the mother is on treatment and the child is on treatment. That's what I wanted to add on.
All right, thank you so much for that addition. So, Dr. Piri, being a doctor, obviously you've come across so many myths and misconceptions that people will tell you about when it comes to pre-exposure prophylaxis, PrEP. So could you just kindly tell us some of these myths and misconceptions that you have come across?
Yeah, so there are quite a lot that we can pick of. Also, I'll speak of two that I've heard that are obviously not true. But so one of them is that once you start taking PrEP, which is some form of from drug, it will affect your reproductive health, and you are not going to ever have children. The second one is that once you start taking PrEP, you are eventually going to become HIV positive. Yeah, so a third one would be that it's not really a misconception, but it's a barrier to accessing PrEP. So this PrEP is mostly provided in the ART clinics. And one of the challenges that is there is that you are going to be accessing PrEP in the ART clinic, and everyone is going to think, oh, that person is actually not HIV negative and they're actually HIV positive. So those are some of the myths and misconceptions that I've heard of that are quite common. And one thing that I would like the audience to know and get out of this is that as much as they are out there, they are actually not true. The conception continues as normally as possible. Anyone that is on PrEP, it does not interfere with your reproductive health, or is not going to prevent you from getting pregnant or having children. So one of the other challenges that we can overcome is actually providing this PrEP from another source other than the ART clinic. So it can be provided in your OPD or in your normal outpatient department. Yeah, I think those are the
Okay.
ones that I've got. Thanks.
Okay, and I think one of the questions that did come up on the ZYP platforms, where we had asked people to share some of the comments or questions that they may have for the show, we noticed that one thing that was coming out a lot is who is eligible to actually take PrEP.
Yeah. So eligibility of PrEP is determined by is determined by risk. Okay, so how possible is it that you can have get infected by HIV or with HIV? So if, let's say, for example, you're a pregnant teen, and your partner continues to refuse to access treatment services. So that would be one criteria that would say, oh, I think maybe my partner that might be positive, because I don't know what their status is. There are also other parameters that we look at. So if your partner stays in a different area, you don't know what is happening wherever they are. So that would also pose to be a risk to acquiring HIV. And then there are those that actually have multiple sexual partners. So multiple sexual partners means that you don't know what is happening with them. So two to three people might be in that kind of relationship. Two adds up to 3, 4, 5, 6 other people that are in that circle. So you'd love to prevent transmission of HIV in that circle by providing PrEP that will prevent a particular individual from acquiring HIV. If I've missed out any, so all those that have high risk, like they're into blessers, for example. So the blessers would be, blesser has a teenager who's 15 years old, has an older girlfriend also, and also has the wife at home. So there's
Yeah.
all that balance that is there, and you need to provide protection for PrEP in terms of PrEP for that particular client. Thank you.
All right, thank you so much for that, Doc. So for those of you that are just joining us today, our topic today is understanding HIV index testing. You can leave your comments on our Facebook, on our Instagram and Twitter page, as well as YouTube. So, Mr. Tembo, earlier when you were talking about index testing, you did mention, the aspect of informing partners who might be at risk, obviously. So is there like a way that people can actually be helped to inform their partners if they are afraid to do the informing themselves?
There is a way, counselors have been trained in ethical index testing. So there are so many methods there are a number of methods of informing the partners. First is the self, where the client will go and disclose that have been tested positive to the sexual partners, so that they can also get tested. And there's also what we call provider referral, or provider supported, where a provider would disclose on behalf of the client. And there's also where the client is supported by the counselor. They sit together to disclose the HIV status of this client to the sexual partner. So there are so many ways. So if like this time before we do index testing, what we are encouraging is to do IPV screening so that we ensure that our client is safe. Nothing bad will happen to the client at the point of disclosure. So there are standard questions that or counseling that the provider will run through with the client to make to understand, to screen if there is any presence of or if the client have ever experienced uh, sexual violence or verbal violence or any kind of violence, because that would also affect treatment. So that is done. So if there's any presence of violence, then the client, the counselor will take it upon himself to go and help disclose the status to the client, to the sexual partner of this client. So there are also ways of disclosing or making sure that this partner is tested. We also encourage, sorry to use this example, but we use it, I like it because we use the Jehovah's Witness approach. Do you know anything about Christ? So you just start it from anywhere, but you know that this person I'm talking to is actually a sexual partner to my client. You start it from somewhere else until you convince that person, you create demand, the person sees the need to get tested, and you test. It's only our record that will show that this person we have tested is actually a sexual partner to this person, but we are not allowed to disclose if the client has not allowed me to go and disclose, so that we make sure that the client is safe from any harm from coming from the sexual partner.
Okay. Thank you so much for that. We have another question from Enoch, who is saying, in an event that I have been indexed and I give true disclosure of my contacts, but also my network comes out negative, what steps are then now taken in this particular instance?
Yeah, can I start? Maybe I
Yes.
can start. Yeah, so I think this is I'm assuming that Enoch assumes that he's HIV positive, and then his contacts turn out HIV negative. Yeah, so in that instance, okay, so you need to follow up with a test 3 months later, because some of those might still be in the window period, what you term as a window period, or where there are the tests that are available, and the tests that are available are not cannot easily pick up the HIV in their blood. Okay, so that would mean that you have to follow them up after about 3 months or so for a follow-up HIV test to just ensure that they are actually HIV negative. Yeah, I think that's maybe what Enoch is going towards. Thanks.
Okay. All right. Thank you so much.
Can I add on?
Yes, please go ahead.
Yeah, to add on that, we should not forget also to make sure that those partners, because they are exposed to someone who is HIV positive, to put them on PrEP. And at the same time, we need to get back to Enoch, the person who has been tested positive. Because in counseling, there is what we call miming a lie. This is a situation where you are counseling a young man or a young lady who has a sexual network, who is in a sexual network, and some of the sexual partners could be elderly women or elderly men. So in our culture, it's not easy to say that I go out with that older woman or I go out with that elderly man. So because of that cultural barrier, especially in our sexual talk and our religious beliefs, so a client may not disclose when sexual partner who could be the one who is positive and infecting other young people. So we need to get back to the client and have another discussion at a different level to ensure that no sexual partner was left out in the network. That is also very important.
All right, thank you so much. Yes,
May I
please go
just add
ahead,
on,
Doc. Yes.
add on one aspect about indexing. So indexing does
Mm-hmm.
not necessarily that you have to come to the health facility. There are actually methods that you can use which are called self-tests. So those self-tests can actually be provided and either assisted or guided or even over the phone where these tests can actually be provided. So someone shouldn't feel ashamed, say, after all, I don't want to go to the health center. That health
Mm-hmm.
center, they know me as so and so. I am this big person in society. So you can actually provide that form of test where it can actually be done from the community or at home. Then from there you say, oh, actually it's negative or it's positive. Then the next steps can actually be reported and guided. No one out there should feel ashamed to say, "Oh, this person, I think we went into into having sex, and we are not ready. I didn't know his HIV status," and then you stay at home without actually knowing what the status is. If you do not know the status of the person that you have slept with today, go to the health center and report and say, I was in a sexual relationship and I had sex with this person about 2 hours ago. Please, I don't know what to do next. We can prevent pregnancy. We can prevent HIV for that particular client. It's a form of protection for that particular client. So you shouldn't stay at home and worry throughout your life without actually knowing the status and actually putting in interventions that can prevent HIV. Thanks.
All right. Thank you so much for that, Doc. I'd also just like to appreciate, the people that have been watching. We do have Choma represented in Kayema. I saw some comments coming in from Mulovezi, as well as Masaiti and Kitwe, so which is really encouraging. I think I'll just allow us to take one last question because time is not with us, but we do have a question from Jackson who's asking, is it necessary for employers to ask for someone's HIV status, for employment sake? Doc?
So legally, no, it's not a requirement. No organization should actually require, even those that are in the medical profession, you're not actually required to have an HIV test. Yeah, so it's not a legal requirement for employment to be HIV, to be tested for HIV in Zambia at least, maybe in other countries, but not in Zambia.
Right,
Yeah.
thank you. Thank you so much for that. Unfortunately, we have run out of time. Time usually does that, I think, when you're having a good time and, the conversations are flowing. But we will encourage everyone to leave their comments or any further questions that you might have regarding the topic at hand, which is HIV index testing, or anything around pre-exposure prophylaxis. And we'll be happy to tackle any of those questions, any pending questions in the next episode. So, Dr. Piri, I'd like you to give any closing remarks in under a minute.
Okay, so I think my closing remarks would go to say the index testing is for that person that you love. It's for that person that you care about. It's for that person that you do not want to turn out HIV positive. And if unfortunately they turn out HIV positive, everyone that lives with HIV nowadays can live a normal and productive life. It's not like in those days where you die in 5 years, in 2 years, or 3 years. So this procedure or this method is to identify and ensure that the person that you love is protected, the person that you love receives the best care. And I think that would be my last comment. Thanks.
Thank you so much, Mr. Tembo. Any last remarks?
My last remarks is on PrEP. PrEP is very good. It's a good strategy. Personally, I take it PrEP is for everyone who is in a sexual relationship, especially an unprotected sexual relationship, because we don't know what our partners do when we are not there. And all those that young ladies that are going out with sugar daddies or blessers, PrEP is for them. Do not feel shy. We have different strategies in those that cannot come out, cannot visit direct facilities to receive PrEP. They can contact certain numbers or counselors so that they are provided with the service. PrEP is for everyone who is in a sexual relationship.
All right, thank you so much for that, Mr. Tembo. You've been watching the Scale Up PrEP Access Campaign live show, and we've been coming to you live on Facebook, YouTube, as well as Twitter. This live show is brought to you with the compliments of the Zambian Youth Platform ZYP, with support from PEPFAR and Chaz. I have been your host. My name is Michelle Malunga, and I was joined today by Dr. Mando Piri, who is the Provincial Pediatric ART Coordinator, and Mr. Kennedy Tembo, who is the Technical Officer at USAID ECAP 2. On that note, we end the show. Until next time, bye-bye.